I'm very blessed to be here with our friends and neighbors from across our state. And not every family from across our state is here, but we're blessed to have these families with us. We have families in every corner, whether it's Posey County or Indianapolis, or whether it's Lawrenceburg or Fort Wayne. And all of us have or know someone with health challenges. And I want to thank the families who are here with me today. For all the talk about politics and vote counts and budget scores and all of these things, the healthcare debate is first and foremost about our families, about our friends, about our neighbors, about everybody who every day works hard to take care of their families. I'm the hired help, and I wanted a chance today to meet with all of our families, to talk to them, to hear their stories, to hear their ideas, to hear the challenges that will be created with some of the discussions that have taken place on healthcare. We can all agree that healthcare should be affordable, it should be well run, it should be done in a way that's efficient and effective, and that if we work together we can do these things. But we should also all be able to agree, and I will make sure that we work hard to get to that point where we don't support proposals that eliminate care for friends and neighbors like the folks who are here with us today. Our children, our families are so precious to all of us. And the families here with me fight every single day to make sure their kids can get decent health care. We should all stand with them. It could be any of our families. And we should have a health care bill that reflects the best of America, the best of our country. It doesn't matter whether you're a Hoosier, a Boiler, a Cardinal, a Sycamore. What matters is we're in this together as Americans. And we all want to make sure there's great health outcomes for all of our families. I want to turn it over to Rylan Rogers because the families can speak so much more eloquently to this than I can. Rylan?
I'm here today as a mom and as a member of this community, as a Hoosier. I'm here because my lived experience parenting 2 children who have complex healthcare needs helps me to live and understand that healthcare is complicated. Our family has benefited greatly from the protections of the Affordable Care Act, and we've been served by Medicaid. It allows us to work, to contribute, to raise our children. It's what every family wants, but mostly I'm here today because I think of all the families like me and the families that will come behind us. The new babies being born in this state who will have complex healthcare needs and who need access to care. I know for sure that it is absolutely a Hoosier value that we will be able to take care of our children, that they will live in our communities, and that they will grow up to serve each other. I know that this healthcare bill doesn't meet those values, and I know we can, will, and should do better. And I urge everybody to think about your neighbors and to share your voice, to share what matters to you, and to speak up on behalf and with families who really want what we all want, to raise our children and to be part of this great state.
Hi, I'm Holly Powie. This is my daughter Avery. Like Rylan, I'm here from lived experience of being a parent of a child with complex care needs. We are a family that has both known healthcare prior to the ACA, since the ACA, and we benefit from Medicaid. And because of all those things, we have and have had to have sort of an intimate knowledge of how healthcare works and serves families like ours. I'm here today because the current Senate bill makes me fearful and concerned about the future of not only my child, but children like her. If we look at taking away benefits that the ACA brought about that have such a huge impact on families and children like ours, and then we also fundamentally at the same time talk about reforming Medicaid, in such a way that we reduce funding and create really holes in this safety net. Our families are left with significant challenges. We are like other families. I think at the end of the day, we want our children to be happy, healthy, and to meet their potential. And quality, affordable, adequate health care allows our children and our families that opportunity. And it allows us as families to contribute, to work, to participate in our communities and society. And I believe that's a value and an end goal that we all, as a collective society, should be able to support. Thank you.
Hi, I'm Beth DeHoff, and this is my husband Brad and our son Kyle. Kyle has a number of disabilities. He has Down syndrome and autism, he's a leukemia survivor, and he has a number of other medical needs. He has a G-tube because his nutrition that he takes in isn't enough to keep him alive. We had health insurance before the Affordable Care Act. It was much improved, and when the Affordable Care Act became in place, and we eventually got a Medicaid waiver for Kyle. The Medicaid waiver helps him to stay at home with nursing care while we work. It allows us to continue to pay for private insurance so the Medicaid expenses aren't exorbitant. It allows him to get the nutrition that he needs to keep him alive. Medicaid waivers are at risk under the Senate healthcare bill. And the only option that families would have would be institutionalizing their children for coverage. There's not a family here that wants to do that. Kyle wants to be at home, and we want the responsibility of caring for him at home. And the Affordable Care Act and the Medicaid program as it is today gives us the freedom and the independence and the responsibility that we want. And we hope that anyone who is interested in this and who is concerned about it will talk to their senators, their representatives, and their friends and neighbors and ask them to do the same. Thank you.
Hi, I'm Abby Miles. I am the proud mom of 3 children, Max, Jude, and Lola. Jude was born 12 years ago with Apert syndrome, and he has endured over 50 surgeries. At what point he was at home with us, luckily through a Medicaid waiver, but he had a trach and a vent and a G-tube. He's overcome so many things that are just mind-boggling to anyone, and he's thriving now. And my fear as his mother with these Medicaid cuts is that he won't be able to continue thriving as an adult, that he will not be able to receive the support to be a functioning member of society. And for him to have survived everything and then to have to say, that's it, but you've gone as far as you can go, is unacceptable to me. And I feel like it should be unacceptable to all of us. These children deserve a future full of life, full of every opportunity that they can grab, and they have all the potential in the world. And I'd love for our government to believe in them too.
The family speaks so much more eloquently than I ever could. And when you ask what this healthcare debate is about, this is very simply what it's about. It's not about the longest speech you can make. It's not about what deal you can cut. It's about our friends and neighbors hoping that their son or daughter can have a clear path to a life with decent health care, to be able to be home with their family and have their hopes and dreams come true, just like everybody else. This is, all of our families are touched by this. And when the next child is born in my family or in another family, one never knows. One never knows what the answers are or what the good Lord has planned for us. But you have families here who are giving everything they have. And it's important to understand they're off working every day, paying taxes, contributing every single day. And the Medicaid waiver program we have helps to provide these opportunities for care. And all of that's at risk. And that's why we fight. We don't fight just because we want this or that, or this tweak or that tweak. It's because we want to make sure our friends and neighbors can get decent health care and be able to sleep at night and not have to worry about what tomorrow brings. So, thank you.